But the medical consequences of chronic alcohol abuse. What are the different organ dysfunctions that alcohol can lead to? We can start from a top to bottom approach. So let's start at the brain. What are the neurological consequences? First of all, chronic alcohol abuse can lead to degeneration of the hindbrain, especially the degeneration of the cerebellum, degeneration of the cerebellum. And obviously that will lead to ataxia. Alcohol can also lead to dementia. There is a high link of alcohol abuse with dementia. And in the peripheral nervous system, alcohol is a common cause of peripheral neuropathy. So cerebellar degeneration, dementia, and peripheral neuropathy. What are the cardiac complications? Whenever a patient has acute alcohol abuse, the patient can develop atrial fibrillation. In case of chronic alcohol abuse, this actually damages the heart muscles, and that causes a cardiomyopathy. Cardiomyopathy. And in the vascular system, it has a negative effect, and this leads to development of hypertension. It's one of the common cause of secondary hypertension. In the respiratory system, alcohol increases the risk of pulmonary tuberculosis, and as it's often can cause aspiration, it can lead to increased risk of pneumonia, especially the aspiration pneumonia. And overall, the community-acquired pneumonia risk is higher in patients with alcohol abuse, especially pneumonia with Klebsiella. That is the classic organism for pneumonia in alcoholic patients. In the hepatic system, hepatobiliary system, initially, alcohol causes a fatty liver. There is deposition of fat. This is known as alcoholic steatosis. Then it develops into steatohepatitis. There is alcoholic steatosis or acute alcoholic hepatitis leading to alcoholic steatosis. And that steatosis leads to inflammation, itis, hepatitis, chronic hepatitis, or steatohepatitis. And in the advanced stage, the patient develops alcoholic cirrhosis of the liver leading to liver failure. In the gastrointestinal tract, the alcohol can start damaging the upper GI, starting from the esophagus. It can cause inflammation of the esophagus, inflammation of the stomach, so esophagitis. So in the gastrointestinal system, it causes inflammation of the esophagus, esophagitis, gastric inflammation, gastritis, pancreatic inflammation, pancreatitis. And whenever a patient, alcoholic patient vomits a lot, it can lead to tear in the gastroesophageal junction known as the Mallory-Weiss tear, where there is hematemesis. And this can lead to Boerhaave syndrome, whereas the esophageal mucosa ruptures and the esophageal wall ruptures or perforates. That is the Boerhaave syndrome. So that is the consequence of the Mallory-Weiss tear. Some of the patients can develop esophageal carcinoma due to the alcohol abuse. Going down, alcohol abuse can lead to chronic pancreatitis also, and this chronic pancreatitis can lead to diabetes mellitus. Chronic pancreatitis leading to diabetes mellitus. Now let's talk about the endocrine consequences of alcohol abuse. Alcohol can lead to hypoglycemia, it's a common complication in ketosis. It can manifest just like Cushing syndrome. So this is known as a pseudo Cushing syndrome. And it can increase the level of uric acid. That is a metabolic complication of alcohol abuse. In the genitourinary system, alcohol is a common cause of hypogonadism. And if a pregnant woman takes alcohol. This leads to the fetal alcohol syndrome. In the musculoskeletal system, alcohol is a common cause of osteoporosis. Alcohol increases the risk of fall and increases the risk of fracture. Alcohol also damages the muscle. It causes a myopathy. Alcohol and statins are some of the commonest causes of myopathy overall. So those are the common medical consequences of chronic alcohol abuse. So if we rewind or recap, starting from the brain, alcohol causes cerebellar degeneration, dementia, peripheral neuropathy. Alcohol also causes cardiac complications such as cardiomyopathy and hypertension. In the respiratory system, it increases the risk of infection by TB and bacteria. In hepatic system, in liver, it causes steatosis, alcoholic hepatitis, and cirrhosis. In the GI system, it causes inflammation of the esophagus, stomach, and pancreas, increases the risk of esophageal tears and esophageal carcinoma. In the endocrine and metabolic system, it leads to hypoglycemia, acido-Cushing syndrome, and increased risk of uric acid. So increased uric acid levels. In the reproductive system, it causes hypogonadism and fetal alcohol syndrome. In the musculoskeletal system, it causes osteoporosis, increased risk of fracture, and a myopathy.